All it takes is a second of not paying attention to end up with a traumatic brain injury. TBI is a brain injury that is caused by an external mechanical force, which often happens in traffic accidents. This might result in a contusion and a laceration of brain tissue. It is a disorder of consciousness. Consequences may include difficulties in cognitive, behavioral, emotional, and sensory motor areas. In the Netherlands, about 85,000 people are diagnosed with TBI. In Europe, about 1.6 million people are hospitalized yearly. Both estimates are likely to be underestimated because some people do not take mild cases seriously and do not seek help. Men are twice as likely to have TBI. The largest group of patients are between 15 and 24 years. 80 to 85% are mild cases. How can we diagnose TBI? There are various brain imaging techniques such as CT or fMRI. Clinicians often look at the duration of unconsciousness to assess the severity of the injury. For example, if a patient is unconscious less than 15 minutes, they are diagnosed with mild TBI. A longer duration of unconsciousness is related to a more severe form. In contrast to mild TBI, severe cases imply permanent consequences. There are two mechanisms involved in TBI. The first is primary damage, an immediate injury caused by biomechanical forces. It can be a result of an open injury which is defined by bone fragments or objects penetrating the meninges. TBI can also be a result of closed injury, which occurs more frequently and is characterized by diffuse damage. Primary damages may include neuronal, glial, and axonal impairments and often require surgical treatments. The second mechanism follows the primary damage and is caused by a disorder elsewhere. This is called the secondary damage. For example, if one body part is impaired due to TBI, this may lead to autoregulation problems such as hypertension. A restriction of blood supply, called ischemia, may be a consequence resulting in oxygen deficit, called hypoxia, and may be the cause of premature death of brain tissue. Secondary damage is associated with an increased risk of developing Alzheimer's disease. Treatment of the secondary damage requires intensive care. Neuropsychological consequences of TBI imply deficits in different cognitive areas, including information processing, attention, executive functions, and memory. Reduced information processing speed is the core of many cognitive problems. Further symptoms are difficulties in language and speech such as fluency and word understanding. Problems in social cognition are alterations in behavior and emotion, including personality changes, decreased perspective taking, and disinhibited behaviors. Patients often have little insight about how they changed, leading to unrealistic expectations about their recovery. Furthermore, patients show a wide range of emotions regarding their restrictions. This increases the risk of developing other psychological problems such as depression. We will look at mild TBI in more detail. Mild TBI may be caused by minor traumata which often happen in contact sports or household accidents. There's a wide range of complaints which are mostly temporary. Patients usually recover after 3 months. Sometimes symptoms start to reoccur years later without the person being aware of the cause. Often in TBI, a failure of the immune system is observed. This may cause inflammation and further cell and tissue damage, worsening long-term outcomes. Symptoms might include physical complaints such as headaches, nausea, and sleep disturbances. Emotional and behavioral problems may include irritability and depressive moods. Cognitive consequences are visible in all domains, for example, reduced information processing. The structural brain abnormalities in mild TBI are investigated by using techniques such as CT and MRI, which can link the lesion with behavioral consequences. Significant decrease in regional volume was identified in various parts of white and gray matter. This indicates that brain atrophy can also occur after mild TBI. Furthermore, restricted movements in white matter pathways have been observed, which can explain the decreased information processing. Functional abnormalities can be identified by using imaging techniques such as EEG and fMRI, providing a clear picture of functional implications of different brain areas. Studies have shown disruption of hypothalamic connectivity in mild TBI, which can be linked to clinical symptoms such as fatigue and sleep disturbances. The medial prefrontal cortex, inferior posterior parietal, and cingulate regions showed decreased connectivity. These areas are part of the emotional network and might explain emotional and certain cognitive consequences following mild TBI. The choice of treatment depends on the severity and location of damage. Often primary damage, especially in severe cases, requires surgery. It is important to focus especially on the secondary consequences. Treatment options include medication that promote neurorecovery and prevention of infections. The psychologist helps patients manage expectations of recovery. In the long term, behavior management is often applied to increase functioning in daily life. Imagine two patients with the exact same TBI. One recovers well and manages to go back to work 3 times a week. The other one needs daily assistance and falls into a depression. What could be influencing factors for recovery? And how can you promote recovery?